Hello, and welcome to today's presentation on exercise through the lifespan. Within this presentation, I will move through the three major life stages: children and adolescence, adulthood, and older adulthood. Additional populations, such as those with hypertension, will also be discussed. But before we begin, disclaimers. I do not have any personal disclaimers. However, there is a medical and a risk disclaimer. By utilizing this medical disclaimer, I am acknowledging that the information within this presentation serves an educational purpose and does not substitute professional medical advice, diagnosis, or treatment. By utilizing this risk disclaimer, I am acknowledging that this presentation includes exercise demonstrations that may not be appropriate for all individuals. We strongly recommend that you consult with your physician before beginning any exercise program. By utilizing this content, you represent that you understand that physical exercise involves strenuous physical movement and that such activity carries the risk of injury, whether physical or mental. And you expressly waive and release any claim that you may have at any time for injury of any kind arising out of your participation in this YMCA presentation. These are the objectives for this presentation. By the end of this presentation, I hope that you will be able to understand the physical activity guidelines set forth by ACSM, the American College of Sports Medicine, for children, adults, older adults, and subpopulations, understand the importance of physical activity throughout life, describe the effects of sarcopenia and osteopenia, and be able to appropriately apply exercises demonstrated to your life. Without further ado, let's jump into this presentation. The first life stage I will discuss is children and adolescents. Children and adolescents encompass individuals aged 6 to 17 years old. Individuals in this age range are going through highly important periods for development of healthy habits and movement skills that will serve as foundation blocks for the rest of their lives. The purpose of physical activity in childhood and adolescence is to encourage health and fitness. When 6 to 17-year-olds are being physically active, they are setting themselves up to have increased cardiorespiratory fitness, strong muscles, strong bones, and a balanced body fat percentage compared to their sedentary counterparts. Promoting healthy decisions and habits can be of benefit to this population due to the increased rate of chronic diseases, such as heart disease, hypertension, type 2 diabetes mellitus, osteoporosis, and more. These chronic conditions are no longer limited to the adult population. They have been entering the lives of these 6 to 17-year-olds. But a key point of this presentation is to emphasize that following physical activity guidelines or just moving can decrease the chances of developing chronic diseases. It is seen that 6 to 7-year-olds tend to be more active than 8 to 17-year-olds. This could be because their quote-unquote job is to play. For example, even though he or she may be enrolled in school, the bulk of their activities is playing. As children get older, they get more homework, they need to help with their siblings and other responsibilities, and this results in their physical activity beginning to decline. To expand a bit more on the decline in physical activity, in 2008, 42% of children aged 6 to 11 and 8% of adolescents aged 12 to 19 met the recommended guidelines in the United States. Recently, it is reported that only about 24% of children 6 to 17 years old participate in the minimum of 60 minutes of physical activity a day. It is examined that physical activity drops with increasing age. So to break it down a bit more, we see about 42.5% of 6 to 11-year-olds met the physical activity recommendations, whereas only 7.5% of 12 to 15-year-olds met the recommendations, and 5% of 16 to 19-year-olds met the recommendations. So we can see that physical activity is drastically decreasing with age. Additionally, as you can see in this figure, there are comparisons between genders. So we see that boys are more likely to reach their physical activity goals than girls. There are a variety of factors or reasons that contribute to the decreases in physical activity. As I mentioned previously, as children get older, they gain more responsibilities, or their interests shift from an active lifestyle to more sedentary activities such as watching TV or reading. Additional reasons could be beyond the child. So what I mean by that is parents may not have the means to place their child in extracurriculars that promote physical activity, or even their living situation, so not having access to a backyard or a park. For recommendations and considerations, we begin with screen time. So according to the National Heart, Lung, and Blood Institute and the American Academy of Pediatrics, children and adolescents should try to limit their screen time to no more than 2 hours a day. According to NHANES, the National Health and Nutrition Examination Survey, half of children, mainly the 6 to 11-year-olds, are meeting the recommendation of no more than 2 hours of screen time. Limiting screen time can help decrease the risk of high blood pressure, high blood lipids, and high glycohemoglobin levels. Glycohemoglobin refers to the amount of sugar within the blood. Excess screen time is also linked to increased adiposity and decreased fitness. In other words, the more screen time your child or adolescent has means the less time they are being active. Limiting screen time and sedentary activities is important to practice with children and adolescents because we are trying to prevent these patterns from continuing into adulthood, where they will become at an increased risk for health conditions such as obesity and type 2 diabetes mellitus. For medical clearance, most individuals within this population are healthy and can begin moderate intensity exercises without medical clearance. They shouldn't have an issue switching from moderate to vigorous exercise, since that's what they should be doing naturally when they're playing. As for their skeletal systems, children or prepubescent individuals should not participate in excess vigorous activities because of their immature skeletal systems. As I mentioned at the beginning of this section, this life stage is where most of their development occurs. The excess vigorous activities can potentially influence their bone development, resulting in issues later in life. Now, I want to stress that children can participate in vigorous activities, just not in excess. Some signs of excess exercise include physical and/or emotional fatigue or exhaustion, a poor immune system, inability to recover from workouts, stress fractures or tendinitis, and sleeplessness. As for immature thermoregulatory systems, this refers to a person's ability to regulate their body temperature. Due to their immature thermoregulatory system, they should avoid sustained heavy exercise in hot, humid environments and remain properly hydrated. Activities should be modified if necessary. Now we are finally examining what the physical activity recommendations are. The recommendations depicted for 6 to 17-year-olds correspond with the recommendations set forth by the Department of Health and Human Services. A key point to remember when trying to encourage physical activity among this group is to allow them to choose what they would like to do. This ensures that he or she will enjoy himself and herself and therefore will willingly participate again. The minimum requirement for this population is to get 60 minutes of exercise a day. This should be attainable, especially when aerobic, resistance, and bone strengthening exercises can make up the 60 minutes a day. So this could be divided into 20 minutes of aerobic, 20 minutes of resistance, 20 minutes of bone strengthening. In case you didn't know, I would quickly like to break down what aerobic, resistance, and bone strengthening means. So aerobic exercises can be thought of as a cardio or endurance activity that incorporates large muscle groups, for example, your legs, arms, and back. Resistance exercises pertain to training with a force against you. You're training different muscle groups through body weight activities or weightlifting. And lastly, bone strengthening exercises are sometimes referred to as weight-bearing or weight-loaded activities. These types of activities place force on our bones, which help to promote bone growth and strength. Looking at the chart, I would like to point out the term submaximal under resistance. Some people know what submaximal refers to, and I'm sure you can deduce what this means. But to clarify, submaximal just means that you are not working or lifting weights to your full capability. So think of choosing a weight or amount of reps that could be considered about 75 to 90% of your max. Every set you complete should feel like you are capable of pushing out a few more reps. So that wraps up the guidelines for 6 to 17-year-olds, but what about those 3 to 5-year-olds? 3 to 5-year-olds aren't included in this population. However, there are some key guidelines for preschool-age children from the Department of Health and Human Services. So as I mentioned just now, preschool-age children are not included in the guidelines from ACSM, but I would say the main difference is that their physical activity is more unstructured and fun. It is recommended that 3 to 5-year-olds remain active throughout the day to enhance growth and development, and caregivers should be encouraging them to play in a variety of activities. Some examples of exercises to strengthen bones include hopping, skipping, jumping, and tumbling. There isn't a set time frame for this population, but the Department of Health and Human Services speculate that 3 hours a day of various intensities is reasonable. What to do now? After receiving the exercise guidelines, you may be thinking, what exercises can I or my children do that could be categorized as bone strengthening or resistance? Don't worry, I have you covered with these 3 exercise demonstrations that are great for bone strengthening and resistance training. The following videos cover the Cub Crawl, Crab Walk, and push-ups. After watching these videos, I hope that it will spark some inspiration within you. The next life stage we will look at is adulthood. In this section, we will go over the general physical activity guidelines for healthy adults and for individuals with diabetes, hypertension, or obesity. Adulthood encompasses individuals who are 18 to 64 years old. As we begin to age, we make choices that impact our health, which can potentially lead to chronic health conditions. Actions or lifestyle changes can be done to prevent, delay, or control the diagnoses of these conditions. One big action that most of us can do is physical activity. Here we have the physical activity recommendations for generally healthy adults. I would like to emphasize that generally healthy adults are able to begin moderate intensity exercise. However, it would be safe to begin at a light intensity. Beginning slowly, especially if you were previously sedentary, is key to success. Exerting yourself too much, too fast is a recipe for disaster, which can result in injury. Examining this chart compared to the chart from children and adolescents, I would say the main difference is more structure within this chart, specifically for intensity. Quickly looking at intensity for aerobic exercise, intensity is described in terms of VO2R or HRR, which means oxygen uptake reserve and heart rate reserve, respectively. These terms are useful in exercise prescriptions, which you would then follow. Intensity for resistance is described in percent of a 1 RM or 1 rep max. This is also great for prescribing a workout. For example, a trainer would run multiple tests on various body parts to assess the maximum weight you can lift in, say, a bench press or a leg press. He or she will then prescribe a percentage, maybe 40 to 50% of that 1 rep max for you to work out at. So these terms are great for understanding and for those that may seek exercise prescriptions. But a term that can be helpful is the rate of perceived exertion, or RPE. Generally, a RPE of 1 to 3 is considered light intensity, 4 to 6 is considered moderate, and 7 to 10 is considered vigorous. Another way to distinguish the intensity you're working at is the talk test. If you're exercising at a light intensity, you should be able to hold a conversation with ease. At a moderate intensity, you can talk, but not sing during an activity. And at a vigorous intensity, you will not be able to say no more than a few words without pausing for a breath. Some key guidelines for generally healthy adults are: some physical activity is better than none. I know that we think exercising can be unattainable. However, completing any amount, even if it's 10 minutes, of moderate to vigorous physical activity can result in health benefits, such as reductions in feelings of anxiety and depression, improvement in sleep and quality of life. Additional health benefits such as weight management, reduced risk of cardiovascular disease, type 2 diabetes mellitus, metabolic syndrome, cancers, reduced risk for osteopenia and sarcopenia are achieved when you work out more, either in duration, intensity, and type. A condition that is commonly diagnosed in adulthood is diabetes, specifically type 2 diabetes mellitus. Diabetes mellitus is a disease that prevents your body from utilizing the energy from the food you consume. Diabetes can result from the pancreas not producing enough insulin, whether it be not enough or none at all, or the pancreas produces adequate insulin, but the body is refusing the insulin present. The latter scenario is known as insulin resistance. Insulin is a hormone produced by the pancreas. Insulin allows the cells all over the body to absorb glucose from blood. It also has other roles, such as aiding in the breakdown of fat and protein, but in the discussion of diabetes mellitus, insulin helps to regulate the levels of glucose in the blood. The two main categories are type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 is when the beta cells of the pancreas are being destroyed via autoimmune destruction, resulting in insufficient insulin. This is commonly diagnosed in children, and the primary characteristics are symptoms are acute or subacute, metabolic ketoacidosis, which is when your body has high levels of blood acids or ketones, is a frequent issue. It is uncommon to have obesity at onset. Beta cells are decreased, insulin is decreased, and it is not common in your family history. Type 2 diabetes is referred to as adult onset diabetes, and this is when the pancreas produces insulin, but the body needs more insulin than what is provided, or the insulin doesn't work properly, also known as insulin resistance. A common feature of type 2 diabetes is excess body fat, specifically located in the upper body. Characteristics of type 2 diabetes include the slow appearance of symptoms, metabolic ketoacidosis is rare, beta cells and insulin status is variable, and it is common to have in your family history. On the bright side, type 2 diabetes can be prevented or controlled through diet, exercise, and weight management. Exercise can help those with type 1 or type 2 diabetes. A common concern with diabetes and physical activity is low blood sugar, also known as hypoglycemia. This is common in prolonged, intense physical activity because hepatic glucose release does not quite match the increased uptake of glucose into the muscles. This effect may last up to 48 hours. Individuals who experience hypoglycemia should be aware of their signs and symptoms such as shakiness, fast heartbeat, headache, and dizziness. To prevent hypoglycemia, these individuals will have to adjust their exogenous insulin. For example, they may have to lower their dosage overnight and/or consume a carbohydrate snack before bed to prevent nocturnal hypoglycemia. This population should also be aware of their blood glucose levels prior to exercise. Once again, here is another chart about physical activity guidelines for those with diabetes. There aren't major differences between the generally healthy adult population and this chart. The only difference is that we see an encouragement of aerobic exercise. We saw in the generally healthy adult population a minimum of 3 to 5 days a week versus the range of 3 to 7 days a week for those with diabetes. Aerobic exercise can improve cardiorespiratory fitness, decrease lipid levels, and most importantly, improve insulin resistance and blood sugar levels. Another condition that is commonly diagnosed in adulthood is hypertension. Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. On the left, you see the blood pressure categories. A normal blood pressure is 120/80 or less. So what do these numbers mean? 120 millimeters of mercury, or the top number, also known as systolic, indicates the pressure within the arteries when the heart beats and pumps blood out. 80 millimeters of mercury, or the bottom number, also known as diastolic, is the pressure in the arteries between beats of the heart. Increased pressure means there is something present within the arteries causing a resistance. The blood is unable to flow as easily as it once did. Typically, this resistance is caused by the formation of plaques against the walls of the arteries. Over a period of time, high blood pressure can result in heart disease, kidney disease, stroke, and death. Here are the recommendations for individuals with hypertension. Once again, this doesn't look too different from the recommendations for those with diabetes and the generally healthy adult. The main difference is the increase of aerobic exercise minimums. The start at the minimum range is 5 days a week versus 3 days a week that was mentioned for previous groups. I would like to mention that chronic aerobic exercise can result in reductions of 5 to 7 millimeters of mercury in resting systolic and diastolic blood pressure, and reductions in exercise systolic blood pressure at submaximal workloads in those with hypertension. Individuals with hypertension should be aware of effects physical activity can have on their medication. For example, beta blockers and diuretics can adversely affect thermoregulatory functions. The last condition we will look at for this section is obesity. Obesity is classified as having a body mass index, BMI, of 30 kilograms per meter squared or greater. BMI is a great place to start, but it does not tell the whole story. BMI can be great for quote-unquote normal individuals, but not so great for individuals who have more muscle mass than the average person. Therefore, additional assessments should be completed. An additional assessment that a practitioner can use is waist circumference. For men, a waist circumference of 40 inches or more places them at a higher risk for obesity-related conditions such as type 2 diabetes, coronary artery disease, and high blood pressure. For non-pregnant women, a waist circumference of 35 inches or greater puts them at a higher risk for obesity-related conditions. Waist circumference is not a diagnostic of body fat or health of the individual, but it is used as a screening tool and can be great in conjunction with BMI. Here are the physical activity guidelines for those with obesity. We are encouraging those with obesity to aerobically exercise for more than 5 days a week for 30 minutes, then progress to 60 minutes a day. Increasing aerobic exercise is recommended to help with weight loss. Resistance and flexibility recommendations are similar to the previous groups mentioned. So what to do now? Adulthood was a pretty hefty section containing different subpopulations. Various physical activity guidelines were provided, but you should follow the guidelines that were applicable to you. At the end of the day, regardless of which subpopulation you quote-unquote belong in, every single person needs to participate in aerobic, strength, and flexibility exercises. What changes is the starting points. For example, an individual who is obese may begin exercising at a shorter duration than someone who is part of the generally healthy population. After training has taken place, individuals, regardless of their subpopulation status, should be able to participate in a variety of exercises, including the exercises that are demonstrated in the following slides. The following videos pertain to deadlifts. Provided is a suggested warm-up for when you deadlift, as well as a regression and a progression of a deadlift. Enjoy! Moving on to the last stage of life that we will examine is older adulthood. In this section, we discuss arthritis and what happens when you do not regularly exercise throughout your life. Older adults refers to individuals who are 65 years old or older and individuals age 50 to 64 years old with clinically significant conditions or physical limitations that affect movement, physical fitness, or physical activity. It is important to note that everyone ages differently. Although someone may be the same chronological age as you, they may be a different biological age. Chronological age refers to the years you have been alive, while biological age refers to how old your body seems based on genetics, physical activity, alcohol consumption, smoking history, among a variety of other factors. With that said, the exercises mentioned in this section is not meant to say that older individuals can only complete these exercises, but rather, in general, the exercises mentioned are safe for this population to complete. Here are the physical activity recommendations for older adults. Provided is further detail in the type of exercises this population should choose due to conditions that may be present. This population may also want to look into neuromotor exercises, which are exercises focusing on balance. Examples of balance exercises are standing on one leg, heel to toe stands, tandem stand, and Tai Chi. For those who are high fall risk, supervision is advised. Arthritis is a common but not a understood condition that refers to joint pain or joint disease. There are more than 100 types of arthritis, but the most common is osteoarthritis and rheumatoid arthritis. Osteoarthritis is a progressive, local, degenerative joint disease affecting one or multiple joints. So this being possibly within your hands, your back, your knees. Risk factors associated with this condition include being overweight or obese, having a history of joint injury, genetics, and aging. Rheumatoid arthritis is a chronic systemic inflammatory autoimmune disease of unknown etiology in which the inflammatory response locally causes inflammation of the joint lining, bony erosions, and systemically muscle loss, fat gain, and accelerated atherosclerosis. Gout is an example of rheumatoid disease. Some general symptoms include but aren't limited to pain, stiffness, swelling, redness, and decreased range of motion at the joint. Diagnosis is done by visual examination, lab test, specifically sampling of the joint fluid, and imaging, so doing x-rays, CT scans, and MRIs. Treatment is primarily focused on relieving your symptoms or pain. So common treatments include NSAIDs, non-steroidal anti-inflammatory drugs, corticosteroids, and painkillers. So how do you exercise with arthritis? The goal of aerobic exercise is to improve cardiorespiratory fitness with little to no joint pain or damage. There is no clear evidence that says individuals with arthritis cannot participate in high-impact activities, but they may have lower cardiorespiratory fitness and muscle strength. It is best that they start slow to minimize the chances of getting an injury or exacerbating any joints. Resistance training may reduce pain, improve physical function, and improve muscular strength and endurance. Flexibility is very important within this population. They must practice on increasing their range of motion in order to avoid negative effects of arthritis in the joints. Extended warm-up and cool-down should be completed, and this should be done in a controlled manner at a very light to light intensity. This population should also investigate the purchase of quality shoes that have features that promote shock absorption and stability. Swimming in warm water can help in releasing muscle tightness and relieving pain. Sarcopenia is one condition that can occur from lack of physical activity. This occurs due to it being an age-associated muscle loss, but the lack of physical activity accelerates this process. If you can exercise, you hold onto your muscle stores. What causes sarcopenia is, as mentioned, from aging and the lack of physical activity, but it can also come about from the reduction in muscle mass from muscle fiber atrophy and loss of motor units, even if you are a healthy, physically active adult, and inadequate consumption of caloric and protein needs to maintain muscle mass. As for treatment, the main treatment for sarcopenia is exercise, specifically resistance training. Resistance training can improve muscle strength, stamina, and help with hormone levels. Another treatment is hormone replacement therapy, which can help with increasing lean body mass, reducing abdominal fat, and preventing bone deterioration, specifically in women. Other treatments that need further research include growth hormone supplements, testosterone supplements, hydroxymethylbutyrate, angiotensin-converting enzyme inhibitors, and vitamin D. For prevention, the main prevention tactic is consistent physical activity throughout life. Make sure to exercise at a moderate intensity for at least 30 minutes a day. Being active significantly decreases your chances of developing sarcopenia as you get older. Other preventative measures include supplementation of creatinine, which increases and maintains your muscle mass, vitamin D for maintenance of bone and muscle tissue, and whey protein, which ensures you are receiving enough protein to preserve body mass. In case you would like a visual of how sarcopenia would look like, this is a cross-section of a young and healthy thigh muscle versus a sarcopenic thigh muscle. The light gray represents the muscle stores. You can clearly see the diminished muscle stores, and this leads to decreased muscle strength and therefore influencing your mobility, independence, and ultimately your quality of life. Osteopenia is another condition that can result from the lack of regular physical activity. As we age, our bones become weaker. However, we can make choices early on in our life to help stall the process. Here is how we can help prevent or delay osteopenia. We can supplement with calcium and vitamin D, even if you think you're getting enough through your diet. Quit smoking if you smoke. Moderate your alcohol consumption. So moderate alcohol consumption is considered 2 drinks a day for men, 1 drink a day for women, or if you don't drink, don't. And lastly, participate in weight-bearing exercises of more than 30 minutes a day, examples being running, walking, jump rope, Zumba, and tennis. Osteopenia results from a variety of factors. We see that genetic factors plays a huge role. It can contribute 60 to 80% of why osteopenia could be present, while lifestyle factors contributes about 20 to 40% of why osteopenia develops. Some risk factors include advancing age, history of fractures as an adult regardless of cause, history of fractures in a parent or sibling, cigarette smoking, having a tendency towards being underweight, being a white or Asian female, having sedentary lifestyles, early menopause, having an eating disorder, high protein intake, specifically animal protein, excess sodium intake, alcohol abuse, calcium deficient diet before and after menopause, high caffeine intake, and being vitamin D deficient. If your osteopenia is not caught early or you are neglecting action, it may progress to osteoporosis. Osteoporosis is practically the same thing as osteopenia, but worse. Your bones become porous and you are at an increased risk for falls and fractures. Treatment may be dependent upon the results from a bone density test. Bone mineral density is determined via dual energy X-ray absorptiometry, also known as DEXA, which is a painless, non-invasive test. The results from this test are called T-scores. A score of -1 to -2.5 is classified as osteopenia. A score of -2.5 and lower is classified as osteoporosis. So if you have a T-score of -2, the treatment would be to complete regular weight-bearing exercises and supplementation of vitamin D and calcium. If you have a T-score closer to -2.5, medications are prescribed from your doctor. This is a picture displaying the spectrum of normal bone to severe osteoarthritis. With osteoporosis, the bone mineral density is depleted, causing big sponge-like holes to appear. This causes your bones to be frail and places you at a higher risk for falls, which can ultimately lead to death depending on age. So what to do now? If you're an older adult, exercising may be viewed as daunting, especially if you haven't been exercising throughout your life. It is important to remember to start slow and progress when you're ready. The following exercise demonstrations are great for those who are just starting out or for maintenance. In conclusion, I would like to emphasize that regular exercise throughout our lifespan has been proven to provide beneficial health benefits and reduce or delay our risk to develop chronic health conditions that were mentioned within this presentation. Exercise may seem unattainable for those who have never been able to stick to a consistent routine or who have present health conditions. But I want to stress that doing something, even if it's 10 minutes of exercise, is better than nothing. You will be able to build from those 10 minutes. So start today and create a new ending for yourself. Thank you for listening.